through now, or made their choice. So this is the last session of the Games Apps and Artificial Reality for Health stream. Last but by no means least in that stream is Ben Green, who's going to present a session entitled Games in Non-Entertainment Environments, Perspectives on Using Games for Other Purposes. So essentially I think he's going to be deconstructing elements of games, what games are and how they can be applied, and very much some of the context that we've been hearing about already today, and certainly in this stream. So I'll hand over to Ben, and we'll take, like we did in the previous sessions, questions at the end. Thank you.
Thank you for the introduction. So yes, I'm Ben Green. I work for the Health E-Research Centre at the University of Manchester. I've been there for about 2 years as a software developer. So just to kind of get an idea of people that are here, who's sort of in research primarily, like academics? Roughly. Have we got any clinicians with us? Okay. And then students and various other folk. So basically, I thought I should probably tell you a little bit about my background. So obviously I work for HERC at the moment, but before that, for about 8 years, I'm a qualified nurse. So I enjoyed that job. I still have many friends who do it, and I still have a lot of time for the people that continue to be nurses. But I decided that about halfway through that period that I actually wanted to change and go for something that was a little bit more cognitive than day-to-day nursing tended to be. So I went back to university and decided to study computer games programming, which seems a bit of a change. And normally when I'm trying to explain this to people, I just say, well, nursing was something I felt that I should do and something that I wanted to do to contribute to society. And then programming and games was kind of my treat to myself, because I'd already started one thing that didn't quite work out, and I thought, well, I should try something that I really love. And one thing about me is that I'm deeply passionate about games. I think an awful lot about them. I'm probably one of the oldest people to not really be able to remember a time before video games. My dad's had games consoles since before people knew what consoles really were. So the one thing that's given me is a sense for two different worlds and the interactions and possibly frictions between two quite disparate worlds. So to find myself back at HERC, which is effectively health informatics, which is again two worlds that I'm quite well versed with, so technology being used to improve healthcare, it's quite handy being able to straddle two very different subjects and gain an appreciation for both. And basically because of my games background, people started to track me down and talk to me about how they could use games in their projects. So I thought this session really should just be about some things that I've learned from participating in other people's projects, from that perspective of games, because it's a specialism that isn't particularly vocal in academic environments. So I'm going to share with you 3 insights that I had, basically from this perspective of 2 backgrounds. So the first is that gamification, the word, is a buzzword. It's being used an awful lot all around the place at the moment, but I don't particularly like it. And this is for 2 reasons, and solely really because it's a buzzword, but 2 things emerge out of this fact. So the first is that generally people, certainly marketing people in health-related work, tend to use it without any specific meaning. So it's almost, well, this is kind of gamifications. I was talking to a team who'd basically made a social networking app, which isn't quite the same thing. So because it kind of means everything, it almost means nothing. But then the other thing is when people, certainly academic establishments, start using things that people have coined, they start trying to find them to mean something beyond nothing, so that you can actually say, well, we definitely have a meaning for this and we're using it because you're trying to get proposals forward. So I found that the definition, through looking at literature, has now generally boiled down to things like achievements and badges, and the core factor in health gaming is adherence to undesirable or otherwise undesirable health behaviours. So, for example, trying to stop smoking. If people wanted to stop smoking, they would. And it's hard. And the same for exercise. If you want to do more exercise, you're motivated to do that, it's fine, but people are trying to use games to do this. So that's why I prefer the term games in non-entertainment environments, because ultimately that's what we're talking about. We're talking about using games to improve health in some way. But that brings us on to a more interesting question. When we say that, what do we actually mean by a game? And this is a subject that most people skirt over because it's kind of a difficult one. So, what is the essential component of a game? And a lot of people, even academics in the field of games, struggle to agree on this point. Several different factors come out, usually conflict or narrative or fun. But there are several examples. For example, with conflict, I can think of maybe 5 or 6 collaborative games off the top of my head that involve no conflict. And with narrative, well, with backgammon and poker, well, there isn't really a narrative. And the most problematic of those is fun, because, well, some games can be fun to me and not to you, and does that mean that they're in some kind of superposition of being a game and not a game? So this subjective opinion of when a game is a game and when a game isn't a game makes it very difficult for people who aren't familiar with the field to be able to say, yes, I'm using a game in a constructive way. So what I did, because I was quite dissatisfied with this situation, was come up with my own definition based on my background in games and thinking an awful lot about the subject for my dissertation. And I came to the conclusion that a game is any situation where a player tries to achieve an objective, but where there's some distance between that player and the control of that objective. So, to give you an example of what that means in a real-world situation, imagine coming across a stone in the street and you decide that you want to move this stone up to a bridge that's about 50 metres or so ahead of you. Now, you've got 2 options. Maybe you could walk over, grasp it firmly in your hand, march your way to the bridge and place it down and congratulate yourself on a job well done. And while you can do that, that's not really a game, because you could directly control the outcome. The alternative approach is that rather than picking it up, you can kick it along the street. And your skill in kicking and the coincidental fact, the undulations of the pavement may mean that it falls into the road rather than being on a pavement, and therefore you failed. And that point, failure, is fundamental to games. So when I've been discussing these projects with people and saying, well, yeah, that's great, I like your idea for a project, the next question I usually ask is, so what happens if the player fails? And professors and early researchers alike tend to go a little bit pale and go, so you want me to tell my person who's trying to do this health behaviour that they don't really like that they can fail in it? And, well, failure is crucial and inevitable in games. But that doesn't have to be a bad thing, because failure can be done in a safe way in order to learn. So people tend to play games, it's thought, mainly because they're doing a lot of learning and because they're doing a lot of prediction, and these are 2 things that our brains reward. So if we're preventing the opportunity to fail, we're actually removing the opportunity to learn. So that's kind of my main point, that really to be able to use games in innovative ways, in ways that people aren't using them at the moment, and to achieve the best results before you've written your proposal, then it's important to understand exactly what games are. So the next point is that the perception is that making games is really easy, and that's for a good reason, because At the moment, we're trying to get kids in schools to be making games and using software and being software engineers. And as a consequence, when I talk to people who aren't that familiar with games, then they allocate very short time and not a whole lot of money to be able to do this big part of their project, and often pivotal part of their project. So I've actually seen proposals where a large game is designed and built in a month according to the project, and these things are quite difficult to do. They require special skill sets, often not abundant in universities, and they take practice. You need to get it wrong before you can get it right. And often when we're trying to make games for health projects, we're hoping that our health effect will be separate to the actual game, so we can assess whether it was the game or the individual that was able to achieve the health benefit. And then this issue of polish, I find it quite common even in software development without games, that academic projects can fall short a little bit of production quality. But the problem with that, especially in games, is that your client groups will know what games should be like, because they play games more than not. I mean, almost everybody plays games in some way. But there is a solution to this. Certainly in this country, and definitely in America, Scandinavia, Germany, there are small communities building of games makers. They're called indie developers. You probably either know the term or have heard the term, or maybe you're aspiring to be one. And they have this skill set, but they also have a need for money, which is great because our projects can deliver money to them, and it can give them work in a period where they may be wanting to make games but would otherwise make websites. So we can use their skill, and they can come to us and understand the academic process and get some money out of it as well, which means that they'll be able to fulfill their creative dreams in the future. So my simple request is to look into your local environment, your local community, and see if you can find your group. Which brings me to my last point, that really to make great games, and to make games or even understand games, you have to play them. So it's exactly the same. You can't really understand music if you haven't heard music. Trying to explain it to somebody who's never heard music, can't even understand what music is, let alone the distinction between one piece of music and another. Experience is the best guide. So my advice is quite simple. Pull out your phone and play a game. You probably already do. Or, if you've got children and they have a games console, pick up the joypad, have a go. I won't tell them, don't worry. Basically, innovation, which is what we're really talking about, comes from understanding two different worlds, like I've done, which is why I've really got to grips with the idea. So in summary, for yourself, or for people who you know who don't really know much about games, or who aren't really sure how they should use them in their projects, my 3 rules are simple. Understand what games are, and more importantly, what they're not. Reach out to your local community, because there will be people out there who are making games and want to help you make games. And please, play some games.
Thank you very much. So, I'd like to invite questions, observations, comments.
You skipped over the slide about ethics. I was curious.
Yes. So in terms of that, one of the considerations in terms of failure, if you're talking about a health behaviour, it can be difficult, certainly in the UK, to consider putting a patient in a situation where effectively they can come to harm. And if you're making the game behaviour the central mechanic of your game, if they can fail at that mechanic, then ultimately they could be harmed by the game. So it's not really that you can't use games in that environment. It's more that if you're going to use a game to try and assert a point or to assess whether somebody's doing something well, then you shouldn't make it immediately obvious that the person is failing in that regard. So an example would be that if you're trying to get somebody to eat healthily, that you use that as the currency to play a game which is exciting in itself, rather than make eating the thing that the game is about.
Okay. So what you're saying is that you're more of a form of encouragement rather than attacking them. So if they want to become healthy, then they have to be encouraged by it rather than dissuaded.
Absolutely right. So I think my point is simply that expect failure in a game because it's essential. So if you're setting somebody up to fail in a bad way, then you need to rethink your game.
Can I ask, then, in terms of health promotion, health education, particularly for children and young people, most of that will be in schools, and it won't be done by health staff, it will be done by education staff. Have you had much experience in terms of encouraging the use of the games in that environment? If we're going to get, I'm thinking particularly of our groups in terms of healthy lifestyles, healthy living, we need to get them when they're young.
So
you asked us whether we're any clinicians. Of course, we
yes.
call ourselves clinicians in education, but
I suppose
we
interventionists.
are working with young people.
So the experience I've had is that there are people that are looking at health promotion. So I work with somebody, Emma Stanmore, who's, although it's not your direct use, she's looking at falls prevention in the elderly, which is a kind of different model to if you were doing something like healing an arm wound. So it doesn't fit into the standard medical model, which is exactly the same as trying to figure out whether somebody would have eaten more healthily or less healthily years down the line. And there isn't a simple answer to your question, because it can be split between the individual practitioner enforcing good behaviour or healthy behaviour in the long term, but then it can also be parents getting hold of an app developed by a third-party company, one that's not necessarily associated with education or health, who basically just thought it's a great idea to get kids to eat more healthily, and as part of that, mum and dad are looking at that app and going, well, maybe we should adjust our lifestyle to fit the things that our child is telling us to do. So I think educationalists and clinicians are the people who can give, in terms of a pipeline of people who can give the experience to say, these are the things that we think our children or our patients should be doing in order to be more healthy in the future. So really, as academics, we should be listening to those people and then communicating with games makers to make the games in the end. Yep.
You're advocating the use of indie developers.
Yes.
Is that something you've actually done at Manchester? And if you did, how did you get around issues like intellectual property or tendering for that particular process, non-disclosure agreements, those sorts of things?
Okay, so we've worked with a company called Mira Technology. They're technically not a games developer per se, they specialise in health games. So we've got a strong IP department at the University of Manchester, and they tend to arrange contracts based on what we need and what the company needs. And in our experience, it's come down to the perceived benefit of the individual company versus our long-term aim for that project. So if we're really only after some kind of research where we can say, yes, this idea works within this area, and then that company can then go on and CE mark that product to sell it, then that's a beneficial relationship to both of us. I think in terms of using your local indie game community, I suspect that would be much more down to, I have an idea and this is what we'd like, and we'd like you to develop it, because they're very used to signing contracts that sign away all of the IP for that idea. Because, I mean, if they're actually developing games for contract, which is the only way to really make money in the industry from that level, then they're going to be more than happy to do that, especially in my experience, with regards to health and education.
Yeah, so for the project that you did, you allowed the partner organisations to commercialise it?
Ultimately, yes.
Yeah.
Yeah.
Are there any more points? Again? I noticed you've gone very much under the time. Maybe that's because David mentioned we're on popcorn essentially.
Possibly.
Sure, are there any more? Thank you.
So I was wondering if in the health environment people, because in this conference we saw that teachers, education and also maybe doctors in education, if like doctors and nurses seems to be against games, or some of them seems to be positive news.
I've not found anybody that's against games, especially if you can show that it's useful and valuable. What I have found is people that are extremely dedicated to their field and therefore just don't know about games, don't know what the range is of games, other than I'm buying this game for my child and I don't really think that much about it. It's almost trivialised because they're not playing them themselves to any great degree, although when you talk to them they probably play Candy Crush or Two Dots or something else on their phone on the bus or train to work. So I've not found any resistance to the idea, but I have found a desire to prove that it actually works tangibly, certainly within a standard medical model of disease or pathology and then improvement as a direct result of a game, rather than using the game may provide some effect that we can't really quantify.
I think that kind of brings to an end that kind of theme that's been running through this strand, which is very much about the multidisciplinary nature of the projects. I know it's very much what you're talking about. It's to recognise the scenarios as discipline as something that has a clear sort of set of skills that are needed.
Yeah.
And if they are needed, to bring those in as part of that project.
Yeah.
Which I think a lot of the research we've been doing about is very much endorsing. So thank you. So we'll just thank Ben again. Thank you. And the other sessions aren't going to be quite finished yet. I think there's some more refreshments due before we break. But there is sightseeing to